Hi, it's Wong with Hands-On Therapy Services. How are you today? It's Monday. We have a 3-day work week this week. It's Thanksgiving week. Who is ready to stuff their faces and roll all over the place over the weekend? Raise your hands. I am. They've all raised their hands. We are ready. I've been baking like crazy. I've been going grocery shopping like crazy, getting ready to prepare Thanksgiving at my house. And who is ready to just eat a ton of food? I know I am. I know that we're very excited to have a few days off. Just to let you know, we will be closed Thursday, obviously. Somebody who, works, and she was like, yeah, give me an appointment for Thursday afternoon. We're like, we're gonna be closed. Did you know that it's Thanksgiving? I think you might know who I'm talking to. So we'll be closed on Thursday, and then we'll also be taking the day Friday to digest everything that we've eaten and then to eat a little bit more, and then we'll be back on Monday, but no worries, we're still here. We're here Monday through Wednesday, our normal hours, and obviously extended as well depending on what our clients' needs are. So just let me know if you have any questions, if you need an appointment. And of course, we're always available via text message. I know somebody we're working with this weekend. I was working with someone during the week and started having a lot of pain on over the weekend on Saturday. And it's one of the great things about our messaging system is you can leave messages and we will get back to you as soon as possible and give you advice or direction, whatever it is that you need, reminders of what you're supposed to do, anything like that. We're here for you, okay? So the topic of this week and for the rest of the month is we're going to be touching up on a couple of shoulder issues. I know I have just been running into so many different people with shoulder problems, and it never ceases to amaze me how much people kind of just suffer with shoulder problems. Latricia, how long have you been suffering with your shoulder problem? About a year or two, yeah. And it comes and it goes and it comes and it goes, and if you don't get to the root cause of what's going on, the problem's just going to continue to linger. It can get worse, and it starts to become a little bit of a problem for other parts of your body, and it's just amazing how kind of snowballs. But there's a way to get rid of it. There really is. And I was just talking to a friend of mine. She actually lives out of town, and she's like, I've just been watching your videos. I really want to come in for a session. And I was able to give her a couple pointers. Her shoulder is really tight, and I'm going to tell you what I told her, which is, there is a difference between if you have muscle pain or if something is going on in your joint. So there's a couple of different ways to find that out, to figure that out, and once you figure it out, then you'll know what you need to do next. And you don't always need to go to the doctor. And she's like, do I need to go to the doctor for it? I'm like, you can if you want to, but what's gonna happen is you're gonna go to a doctor, and then all they're gonna do is tell you to go to therapy. Right here, you can just come straight to therapy, and we will help you solve, what's going on. Is it a muscle problem? Is it a joint problem? Do you have a lot of tightness? So I'm gonna give you a little tip, okay? And this one tip is hard for you to do on your own, so you kind of have to get someone else to do it. And then maybe if you do it to them, they'll do it to you. Okay, Latricia, come on over here. So I've been running into a lot of people who have really tight shoulders or traps. Let's see, we can fix this a little bit. Oh, can you lower the seat? Because I'm so short. I think that was okay. How's that? Perfect. So a lot of people with shoulder pain compensate a lot. So they don't even realize that. I'm exaggerating, but most of the time they do. They're either trying to be away from their arm, or they're like trying to use their head to support their arms going up. Either way, it's just bad biomechanics, and it just kind of over time gets worse and worse and worse, and people get really, really tight right here, right?
Yeah.
Yeah, she's like, oh. So, you know, it's hard sometimes to get people to give you a little massage, even if it's 5 minutes, okay? And so one of the things that I like to do is, instead of using your hands, I like to use my forearms, okay? It's just easier. So I go ahead and I rest my forearms right up on the top part. And this is what I do. I seesaw it back and forth. You put a little bit of pressure. That's why you have to have someone sit a little bit low. And then usually it's not a problem. I'm so short. But you can kind of seesaw it back and forth. And it's just the amount of pressure just depends. And you can just literally put your arms right on top of their shoulders and just lightly press, okay? And then you can move it back and forward. You can ask them to stretch their neck. So looking forward, Latricia, you're gonna bring your ear down to your shoulder. And because my arm is right here, you see it moving, I'm on the right side of her shoulders, just gonna let her stretch it out a little bit more, and then bring your ear to the other side, and then I'm gonna put a little bit of pressure on that left side. How does that feel?
Feels really good.
So now that I've done it to her, do it to me.
Okay.
This is how you get a little bit of a
tit for tat.
Yes, that's right. Wait, hold on.
Sorry.
Okay.
Okay, relax.
Okay, I'm relaxed. Ah, yes. So
Go up a little
yes,
bit. There we go.
There you go. It almost looks like she's trying to choke me. It's like, what was I yelling at her about earlier? But oh my God, that feels so good. So I was actually helping somebody with a shoulder problem, and she's been having shoulder, like just tightness on both sides, and her husband is really stressed and tight too. And I'm like, okay, do this to him so you can help him relax, and then after you do that, be like, oh, practice on me, and then everyone benefits, right, Latricia?
That's right.
Everyone benefits. Dulce's gonna just stay over there because all right, so that's my tip for today on kind of just like massaging and keeping the tension out of your upper shoulder. And if you have any questions or concerns about your shoulder and the pain you're having, then leave me a comment below and we can talk about it next time. All right, thanks. Bye.